Hello FMG, today we are going to see biochemistry one-liners. Tyrosine is oxidase, anticoagulant used for preserving blood for PT estimation is sodium citrate. Chemical steroids are derived of pre-hydrocyclopentophenethrin. Biotin deficiency is characterized by muscular pain, nausea, dermatitis. Zinc is a component of carbonic anhydrates, insulin, carboxypeptides. Respiratory content of fat, protein and carbohydrate are 0.70 to 0.80 to 1.0. In glycolysis, which of the iron is most important is magnesium. Prostaglandins are acyclic fatty acid derivatives. Thiouracil inhibits thyroid function by inhibition of thyroxine synthesis. Cytochromes or iron peripheral proteins. Vitamin act as a respiratory catalyst is vitamin C. Correct sequence of breakdown of hemoglobin is HB, heme, biliverdin, bilirubin, urobilinogen. Histidine decarboxylase is present in liver and kidney. Dietary changes are not required in Wilson disease. Content consists of 3 consecutive nucleotide units. Coenzymes are non-protein organic compounds. Air is rich in amino acid cysteine. Component of coenzyme A, pantothenic acid, aldehyde acid, sulfuridyl group. Renin is present in stomach. Methionine is important in the formation of choline. Acetomycin D interferes with enzyme induction by combining with DNA. Ketone bodies are products of metabolisms of fats. Xeroderma pigmentosa, a rare skin disease, is due to autosomal recessive trait, which cause deficiency of specific DNA endonuclease. Lactate dehydrogenase is isozyme. Ketone bodies are normally synthesized from acetyl S-CoA. Creatine is formed by metabolic from arginine. Blood-brain barrier is maximally permeable to CO2. Which of the following vitamin is destroyed by heat? Biotin. Daily normal excretion of ketone body is 1.0 mg. In mammal, protein sequence take place chiefly in rough endoplasmic reticulum. Derived from protein is peptones. Exokinase is a transferase, which is the byproduct of urea cycle fumarate. False positive reaction of glucose is seen with aspirin. Which of the following is not trace element is calcium? Citin is a polysaccharide. Bioretrate test is mainly done for protein. In metabolic acidosis, are true about urine change in increase in ammonia. A codon consists of 3 consecutive nucleotide units. Monoclonal electrophoresis is useful in the diagnosis of multiple myeloma. Basic structural unit from which fatty acids are derived is acetyl-CoA. Precursors of the cholesterol synthesis is acetyl-CoA. Whole wheat is an excellent source of thiamine. Citrofilin is a transferrin. Which of the following is not phospholipid? Seroside. Triglyceride in serum are transported by VLDL. In 1 molecule of glucose form 2 molecules of pyruvate. Which of the following is a inhibiting amino acid for protein synthesis is methionine. In mammalian cell, protein sequence take place chiefly at the nucleolus. Insulin resistance may be due to acromegaly. Cytochromes are iron peripheral proteins. Which of the following seen in obstructive jaundice, excess of bile salts in urine? Which of the following cannot be metabolized in the body? Sucrose. High threshold substance in glucose. Millen's test is used for detection of tyrosine. HMP shunt is great importance in cellular metabolism because it produces NADPH. Urea is produced by enzyme arginase. Acetomycin D interferes in enzyme induction by combining DNA. A bilipid layer is most permeable to urea. The lactate dehydrogenase levels are increased in glycine. The most direct precursor of pyrene is cysteine. Aromatic ring is present in phenylalanine. A substance having affinity but no interesting activity is antagonist. Which of the following essential fatty acid contains maximum number of carbon atoms? Arachidonic acid. Ferritin and inactivate form iron is stored in liver. Cholesterol is synthesized from acetyl-CoA. First product of glyconeogenesis is glucose 1-phosphate. CAMP increase glyconeolysis by contributing phosphate. Bohr effect is effect of PCO2 on oxyhemoglobin desoxification. Tea and coffee contains tannin. Specific dynamic action is energy expected on consumption of foods. Indigestion of benzoic acid in man result in increase in urine uric acid. An essential amino acids the man is L-methionine. The mycopolysaccharide hyaluronic acid is found primarily in vitreous humus of eye. Ketosis is partly due to overproduction of acetyl-CoA. A substance having affinity and intrinsic activity is partial agonist. The commonest enzyme deficiency of glucose 6-phosphate and ammonia acid not involved in urine synthesis is citrinate. The most abundant protein is human body's collagen. Sorbitol is a sugar alcohol. Decumarol is an anti-metabolic of vitamin K. An essential of conversion of glucose to gluconeogenesis liver is UTP. Inhibitors of DNA synthesis acetomycin. Million test is positive in thyroxinases. Most important buffer in extracellular fluid is H2CO2, HCO3. Inhibition of glycolysis by O2 is known as Pasteur effect. In human body, which of the following trace element is next to iron is Cu+. Which of the following is dietary essential is linoleic acid. Patient with several renal disease may be not able to use normal dietary source of vitamin D. Winslow test is used to estimate serum or urinary amylase. pH is maximum in pancreatic secretion. Dawn phenomena refers to after breakfast of hypoglycemia. Hendrix test is done to detect urobilinogen. Benzidine test is positive with enzyme peroxidase. Enzyme deficiency in alkylpynuria is homogenistic acid oxidase. Wilkins encephalopathy is due to deficiency of thiamine. Creatine is synthesized from glycine, arginine, and methionine. Cyanide is toxic because it inhibits cytochrome oxidase. The substance essential for transfer fatty acid across the mitochondrial membrane, carotenoid. Which of the following organs cannot use ketone bodies is liver. Lipid from tissues is carried by liver by HDL. Unsaturated fatty acids are converted to prostaglandins. Vitamin necessary for A synthesis pantothenic acid. Laminin is present in inner nuclear membrane. neetpg is used to fatty acid synthesis. Thiamine is essential for pyruvate dehydrogenase. Monocytosis is due to abnormal metabolism of methionine. People eating only maize, a staple diet, will develop niacin deficiency due to lysine. Thromboxane is mostly produced by platelet. Normal value of BUN is 10 to 20 mg per dl. Alcohol uric jaundice is caused by hemolytic jaundice. Oxidation of fatty acids occur in mitochondria. Triple helix is seen in collagen. Urinary protein is detected by barefoot test. Glutathione peroxidase contains selenium. Cholesterol is a steroid. Saturated fatty acid is present in high quality of coconut oil, which is correct about intercellular fluid amount more than ECF. Keratin is chemically sustained. Untreated diabetic leads to tissue use fatty acid as main fuel. Protein synthesis takes place mainly in the ribosomes. Most common of lactic acid is circulatory failure, not cause of metabolic acidosis, climbing to high altitudes. Vitamin also acting as hormone. Vitamin D. Proteins binding to DNA as zinc. One of the following is scavengers of cholesterol from tissue, prevents atherosclerosis is HDL. DNA fragments are separated by hydrocell gel electrophoresis. Ferritin stores are present inside intestine, liver, spleen, but not in bone. Osmolality is moles per liter of solvent. And beriberi, which enzyme activity is measured as transkeratinase. An exclusive protein meal intake will cause hypoglycemia. Hard use one of the following energy source during starvation is acetoacetate. In maple syrup urine, absence of ferric ion test with urine gives color blue. Mossy or misty odor urine is seen in phenylketonuria. Carnitine is formed from lysine. Arthritis occur in alkaptonuria. Norepinephrine is converted to epinephrine by N-methylation. Most important compulsory mechanism in metabolic acidosis is hyperventilation. Translation occurs at ribosome. Cytochrome P450, P stands for pigment. The reaction inhibited thiamine deficiency is pyruvate to acetyl-CoA. Skeletal muscles is deficient in glucose 6-phosphate. Alcoholic group is found is galactosides. About glycosis crew is complete breakdown of glucose. Familial hypercholesteremia is deficiency of LDL receptors. Cholesterol maximally carried in LDL. Most abundant collagen is blood. Body is type 1. Enzyme not present in muscle, glycose 6-phosphates. What is the technique which DNA can be amplified by polymerase chain reaction? Null mutation is mutation which produces no function gene product. Which one is nonsense codon? UAG, UGA. Which of the following amino acids is associated with increased risk of MI is homocysteine. Glutathione peroxidase contains selenium. Which one of the following enzyme use NADPE as coenzyme is G6PD? Lung surfactant dipalmitoyl lecithin. Fatty acids of cholesterol are mainly palmitic stearic acid. Shortest peptide is encephalin. In acute MI, which amino acids level rises in blood? Homocysteine. FIGLU metabolic of histidine. Which of the fructose inulin? Which fatty acid non-sensitive by steronic acid? Saponification means hydrolysis of fats by alkali. In pregnancy, amount of glucose used in GTT test is used in 100 mg. Total number of genes in human beings is 50,000. Naturally occurring amino acid is hydroxyproline. Northern blood is amplification of mRNA. Source of ammonia is urine is glutamase. Bilirubin is produced from hemoglobin, myoglobin. Pyruvate utilization in tissue decreases in beriberi. Amino acid used in synthesis of purines, glycine. Selenium is an essential component of glutathione peroxidase. In porphyria cutánea, the type of porphyria excreted in the urine is type 1 and type 3 uropyranus. Thank you.